For those of you who don't know me, I'm Nicky Parks, I'm the Clinical Director of the Hospice, and I wanted to make this video to try and give you some reassurance around the steps we are taking to ensure your safety in this current crisis. We understand that these are difficult times for us all, adjusting to this new world that we find ourselves in currently, and as a management team we appreciate how your working lives have become uncertain and how this can induce additional stress and anxiety. But we do want to reassure you that as our leadership team, we are really working hard to ensure that you have the resources you need to continue to provide the excellent care and that you are protected. So I wanted to take this opportunity to update you all on the PPE situation currently and the steps we are taking at all levels to ensure the hospice has a consistent supply and that our resources of PPE are utilised appropriately. Currently we have the correct PPE for the use for a suspected or confirmed case of COVID-19. This includes the appropriate use of fluid-resistant masks, gloves and aprons. Jenny Pilkington, our practice development sister, has been working hard to ensure that the information is cascaded. But I want to stress it's really important that we use our vital resource effectively in the right situation. You will have seen in the press concerns raised about access to personal protective equipment, especially in relation to the respiratory masks. The masks themselves are really not the issue, but the problem is with fit testing. Each individual mask has to be fitted to each individual person, and one of the problems that we've encountered is actually the solution that's utilised in order to ensure a correct fit. We do now have access to fitting and we will be prioritising staff accordingly. These types of PPE, so the respiratory masks, are really got to be prioritised for use where there is an aerosol generated procedure. So for us in the hospice, an aerosol generated procedure would include non-invasive ventilation. And I have to reassure you that currently we have one patient in the community who requires non-invasive ventilation. An example at the hospital would be all of those patients that are on ventilators. There have also been some concerns raised about nebulizers, and in particular nebulized saline. And although this risk is really low, we've taken the decision as a management team and a medical team to stop using nebulizers. The reason for that is that nebulizers can induce coughing, and coughing can increase the risk of exposure to COVID-19. So instead we will be using medication via a spacer and using inhaled medications to ensure that our patients remain symptom-free. We are also part of a locality-wide response to COVID-19, and we are having daily conferences with all our partners across the Fylde Coast. PPE is always the top of the agenda. I want to reassure you that we have received supplies, so we are getting our normal supply routes through NHS stores, and we've also had regional supplies from the CCG. And we are sourcing PPE from a variety of external sources. However, this is a challenge. PPE will remain an ongoing challenge over the coming weeks and months, so it is vital that we use our resources as I've discussed, and that we use them for the right patient at the right time in the right situation. Finally, I wanted to say a huge thank you for all your continued support. The hospice will undoubtedly become busier over the next few weeks as we try to support our colleagues at the Acute Trust and that we release vital bed capacity. There will be undoubted higher expectations of us all and an increased expectation on all of our services. But we are all in this together and we are doing everything we can to ensure the risks to our staff are minimised. Thank you.